Relapse is still the major cause of treatment failure after allogeneic stem cell transplantation for many diseases, but also for acute myeloid leukemia, which is the most frequently used indication for allogeneic stem cell transplantation. So in the last 20 years, there has been major progress in reducing non-relapse mortality. However, the relapse incidence remains still pretty high. So in the last 10 years, there were many efforts done, more biological, but also on the clinical side, to improve outcome regarding stem cell transplantation, especially with respect to relapse. So several issues to include maintenance therapy have been proposed and are conducted. So currently, prospective studies have shown there is a benefit for FLT3 inhibitors in FLT3 positive leukemia patients in randomized studies. So this has been shown by a large Chinese and also by a German study. And also the next generation of TKIs, FLT3 inhibitors, are currently in clinical studies to get approval as maintenance. But also other molecular markers like IDH inhibitors and others, donor lymphocyte infusion, and also other cellular therapy are currently investigated to reduce the risk of relapse. So this is an exciting new field in the field of transplantation, and the preliminary results that we have so far, the preliminary results, looks very, very encouraging.